The proper way to perform CPR. First, you want to check for responsiveness by tapping the person's shoulder and shouting, "Are you okay?" If there's no response, call 911 or ask someone else to call immediately. Position the person on their back on a firm surface. Kneel beside their chest. Place the heel of one hand on the center of the chest, between the nipples, and your other hand on top, interlacing your fingers. Keep your arms straight. Position your shoulders directly over your hands. Begin chest compressions. Push hard and fast at a rate of 100 to 120 compressions per minute. Compress at least 2 inches deep for adults. Allow complete chest recoil between compressions. You should minimize interruptions. After 30 compressions, give 2 rescue breaths. Tilt the head back slightly and lift the chin. Pinch the nose shut and make a complete seal over the mouth. Blow in for about 1 second to make the chest rise. Give a second breath. Continue cycles of 30 compressions and 2 breaths until emergency services arrive or the person shows signs of life. If untrained or uncomfortable with rescue breaths, perform hands-only CPR with continuous chest compressions. Pros: can double or triple survival chances and maintains blood flow to vital organs. Anyone can perform it, even without training. Immediate action is better than waiting for professionals. Cons: physical fatigue sets in quickly for rescuers. Risk of fracturing ribs, especially in elderly. Without proper training, may be less effective. Rescue breaths will carry a minimal disease transmission risk. Remember, if uncomfortable with rescue breaths, perform hands-only CPR with continuous chest compressions.